Okay, so now we're looking at the sternum. Okay, so on our sternum, you've got three sections of it. The manubrium is this top part, the body, the long part in the middle, and the xiphoid process is here at the bottom, kind of the pointier part at the bottom. Okay, the manubrium is separated from the body by the sternal angle. Okay, you have notches here at the top, so the one in the middle is our jugular notch, and then on either side is our clavicular notches. That's where the clavicle comes in and articulates with it. You can also see all these things on the sides. These are not ribs, they're cartilage, the costal cartilage themselves. Okay, so our cervical vertebrae, we have 7 of these. We have 12 thoracic vertebrae and 5 lumbar vertebrae. So the common phrase for this is breakfast at 7, lunch at 12, dinner at 5. Okay, so remember 7, 12, and 5. Now, the cervical vertebrae, the first 2 cervical vertebrae are kind of special. You have the atlas, which is C1, and the axis. So our atlas looks like this. So it's very flattened. It's actually what articulates with the skull itself. Okay, so it has some of the main characteristics that we see on all the other vertebrae. So you can see the large hole here. So this is our vertebral foramen. It's also got the characteristics that we find with cervical vertebrae. So you see these transverse foramen off to the sides. Okay, so that's our flat atlas. Our axis, on the other hand, not so flat. We can see it actually has this large protuberance coming off the top there, called the dens. So this dens articulates something like that. Okay, we can see it still has the vertebral foramen, the transverse foramen, so we know it's cervical. And now we're actually starting to see this other form, the spinous process, that sticks off the front there. So all our other cervical vertebrae look something like this. So you have the body, vertebral foramen, transverse foramen. You can see the spinous process. The cervical vertebrae also have a bifid process, so it's kind of split in 2 there. Okay. We can now look at the thoracic vertebrae. So again, we have a body. It's larger, of course, than our cervical. You've got this very downward protruding spinous process. You can see it's no longer bifid, it's just singular there. And then compare that to our large lumbar vertebrae here. So let's look and kind of compare. You can see the body there is exponentially larger in our lumbar. It's huge, comparatively speaking. You've got a large spinous process. It's not nearly as downward protruding as in our thoracic vertebrae. Okay, this is our sacrum. Okay, so the sacrum itself is actually 5 fused vertebrae together. Makes up the bottom part of the spinal column. So we're looking at the top part of it here. Okay, so we can see the median sacral crest, so this ridge that runs right down the middle. Okay, you can also see your sacral hiatus, so it's this opening here on the bottom. This is typically only visible in a real skeleton, not in any of the plastic models you might be looking at. The sacral foramens, okay, so these individual holes here. If we flip it over, we can see the sacral promontory right along here. We can see the ala right off to the side. We can see, if we look down the middle here, okay, so you see this other large hole right here where our spinal cord would actually enter in. That's the sacral canal.